The EyeSpecial C-II digital dental camera by Shofu is really designed exclusively for dentistry. First of all, I want you to notice that it's very, very lightweight, maybe weighs 2 pounds. The other thing is that it has this nice little handle where you can actually hold it like this, or you can slip your hand in and just make sure that everything's nice and secure, and that's really how I like to handle it. So the first thing that we're going to do before we get started with the camera is I've got my 4 AA batteries, and what I'm going to do is open up the end of the camera, but before I do that I'm going to turn it, and I'm going to just slide it open, really easy to do. Okay, and I'm going to look here just to make sure that I put them in correctly. So basically it'll give you an image as to how the batteries are going to go in. Okay, then I'm going to shut it all the way, push it forward, and then I'm just going to lock it to place. And I'm going to make sure that I turned it on correctly. And I did, because now my green light is getting ready to show up. Okay, so now I'm ready to go. The other thing that I want to make sure of is that I have a camera card in here, and you have a choice. You can either use something like just a regular standard card. In this case, I'm using a Wi-Fi card, so this way I can actually have my images come up on the screen and my operatory right away to be able to show my patients. That's the difference between using just a standard 16 gigabyte card or using a card that may be an iFi, and I just like the iFi to be able to show them instantly what those photos look like. So the way to do that is just kind of open up the side of the camera, and I never want to just slam this into the camera, because what happens is these little prongs can get bent. So I'm going to just slip this in, you'll hear it click, okay, and then just shut that back, and now I'm ready to go. The best part about this camera as an assistant, and we hear this all the time, is it's very lightweight. You can see, I mean, I bet this thing probably weighs a whole 2 pounds. The other thing that's great about this feature is it has a little handle here, and a lot of times what we hear is that assistants are worried they're going to drop it, and so it just makes it easy to hold it if you want to use this. Personally, I'm so used to just holding it on the end that I will just hold it just like this, but it really doesn't matter to us, whichever feels comfortable to you. When we talk about the camera and the ease of it, it is so foolproof. I almost say it's dummy proof. You can turn it on, as you can see here. When I've got my on-off button, of course, I'm going to turn it on, okay? You're going to see a little green, first red light and then a green light come on, which tells me that it's ready. You'll see that here in just a minute. So, of course, it's going to be red, yellow, and then green. To focus, which we always know, very easy, you're going to just halfway hold down the center button in order to focus and to be able to find your patients. But let's talk about some of the great things about this camera. You can preset a lot of the settings where you've got a F1, F2, F3, and F4, which is fine. You can preset those. I'll tell you, I don't preset them because it's so easy to use. I feel like I don't even need that. What I do is to activate the camera, I'm just going to touch the screen. What comes up first is just really a lot of information just to familiarize yourself with the camera. Once you've learned that, you can just push the little screen and get started. The first 3 photos we're going to take are going to be our full face photos and our profile shot. A couple of things to remember before we start is, first of all, I really want to have a nice backdrop. I either like those in blacks, grays, or blues. The other thing that I want to make sure of is that I stand far enough back from my patient to where I'm going to get about the shoulders to the top of the head. I never want to cut off the top of the head. I really want to have a nice full face photo. Couple of things to think about. I hear this a lot in a lot of practices, is that they'll forget to take this picture. Regardless of whether it's for Invisalign or it's for an aesthetic case, I always want to make sure that I start off with these photos first. And the reason being is because once we go into our retracted shots, using retractors will sometimes make the patient's face red. You think about it, from taking the retractors in and out of the mouth. So ideally, before I take any photos, these are the first 3 that I want to take. Now let's talk about positioning and the camera modes here. You could take all these photos in a standard mode. The beauty of this camera is that I'm able to change it from the standard photo setting to a full face setting, which I feel is more designed for these photos. So what I want to do is I'm just going to kind of activate my camera here by pushing the little button. You'll see here where I've got it in mode, and there's a couple of modes to kind of choose from. We've already talked about some of that. Whether it was the standard, which you could use for everything, our surgery, mirror, face, low glare, whitening, telemacro, and isolate shade. Now, I want to choose the face because that's the 3 photos that I'm going to be taking first. So I'm going to push the face, piece of cake, and I'm ready to go. Before I start, I want to also look at my up. You see where it says up and it has an arrow going this way? It's going to remind me to shoot all of my photos with the camera angled at this position, which is great. It's so foolproof and so easy, it never lets you forget a step. And so what I'm going to do is I'm going to turn it this way, and Haley, I'm going to have you put your hands out to the side and bring your chin down just a little bit, okay? The other beauty of this camera is I have a nice line going right down to the center of the face, so I can make sure that I am, again, focusing on the nose, but I'm centering everything. And so with the grids, it allows me to really have a nice position. I'm going to back up again just a little bit more. And I'm going to take a really nice full face photo. And let me just turn it here and push play so I can show to the camera here exactly what we've got. And you can see that really nice full face photo there. Now, I'm going to push the activation, turn it back this way. And Haley, I'm going to have you do what's called a repose. It's where you're going to lick your lips really good, breathe in, and just kind of breathe out. Perfect. And stay just like that for me. Okay. Now what I'm going to do is I'm going to have you turn your head this way, and notice in this photo her hair is in the way. So what I'm going to ask Haley to do is take the rubber band that I've given her, and I'm going to have her pull her hair back so I can see the ear. Remember that when we submit cases to Invisalign, we're going to take a full face with a smile shot, we're going to take a repose, and then I'm going to take a profile shot, but I don't want the hair in the frame. So I always have the patient have a rubber band, or I bring a clip so we can just pull everything back. And Haley, I want you to bring your head down just a little bit for me, and I'm going to line up my grids again, okay? And my focus is really pretty much right in the center. And it's just a beautiful, beautiful, easy photo. I love this camera for that. When I go into my play mode, I can really show you exactly the photos that we've taken here. I've got a really nice profile. Notice I got a little bit of the shoulders. I didn't cut off the top of the head. And I can just scroll through these. Really nice rest and a nice smile, okay? So I'm really, really happy with these pictures. Remember, again, I can't say enough, I really want to think about every patient as someone that I can use for marketing. And again, when I submit my cases to Invisalign, I want to be proud of my photos. I don't want to just halfway do it. This camera is so foolproof. It helps you with the grids to make sure that you line everything up. Everything's really nice, always nice and straight and parallel. It makes a really big difference. When the patient sees that I'm really taking my time, I'm being very, very picky with these pictures, they know that I'm going to be picky with my records. And remember, it all starts from the photography. I can't say enough about that. So now we're going to go to the chair, and we're going to take all of our intraoral photos, and then we're going to take our mirror shots. Before we start, I want you to notice that our patient, Haley, does not have a bib. This is really, really important, and we've talked about this in the lecture. I don't want to bib my patient. Remember that when you bib a patient, they go right into a clinical environment. Taking photography is probably one of the most intimate things you can do with your patient. The other thing that I want to encourage you, if you're the one that's taking the photos, is that we find that we connect more, there's not a barrier, and we're also able to talk more about treatment. And so I use this time as I'm taking the photos to continue conversations with my patients, but also to encourage them to allow me to take the photos, because most of the time we know patients really don't want us to take their pictures. And so I want to utilize this time to make her feel more comfortable. But let's talk about positioning. The first thing that we're going to do after we're finished with our full face photos is, of course, we have our patients have a seat in the chair. Ideally, most patients are going to sit in the chair and they're going to prop their feet up and get really comfortable. Well, this is kind of hard to do whenever we're going to be taking our full smile shots, our retracted shots, and most importantly, our buccal views. So what I'm going to do now is have my patient bring her legs around, and we're going to sit knee to knee with the patient. Now, The reason we're in an operatory today is because I want you to understand that this is where you're going to be taking all of your photos ideally. So we know that operatories are small unless you're really lucky and you have a huge operatory. So it's going to be tough for us to really, be able to get further away from each other. This is going to be a very intimate procedure here because we're going to be knee to knee with the patient. So what I'm going to do is I'm going to have Haley swing her legs around for me, Haley, and I'm going to have you just, there we go, perfect. Now notice I'm pretty much where I need to be. If you look at where I am and where she is, I may be just a little bit taller than her. So I'm going to grab my camera and I'm going to show you what happens if your chair is too high or too low. Because remember that I want to shoot straight on, have things really nice and parallel. The great advantage about the camera I'm going to be using is it is gridded to make sure that we can line everything with the midline, we make sure everything's nice and straight. But I still want to make sure that my patient's chair is the same as mine, as far as the same height. So let me just demonstrate that really quickly. So I'm going to grab my camera and I just want to show you what happens if you're not in the right position. Notice that my chair is a lot lower than the dental chair. So if I'm going to shoot my photos, I'm going to be shooting them up, and you can see the angle of the camera. Now again, this camera shows us that we are going to be off and we're not going to be straight and parallel. But let's say that we do take the photos, what's going to happen is I'm going to be shooting up. The other thing that can happen is a lot of times our chair can be too high. So if my chair is really high, I'm going to be shooting down. So now what I want to do is just lower my chair, again, to make sure that I am the same height as my patient. And this way, as I'm taking my photos, I can make sure that my camera is really nice and parallel. And again, notice that we're knee to knee. Okay, I'm not standing to take my photos. I'm not leaning over the patient. I want to make sure that everything is really nice and straight across. I don't want to have a cant, because a lot of times what happens is as we send these photos out, whether it be to Invisalign or it could be even your laboratory for laboratory work, we want to make sure that they know the patient doesn't have a cant and everything is really nice and parallel. So lick your lips really good, Haley. And I'm just going to pull this up here, nice and parallel, and give me a really, really big smile. And notice how I'm able to really line up my camera and get a really, really good photo. And let's go back. I want to push play. And let's take a look there. Notice that I had the same distance here as I do here. So the next photo that we're going to take is going to be our retracted biting together. And we're going to use some unique retractors that are double-sided. One-sided is more shaped like a C, and I'll show you that here in a few minutes. And then the other side is going to be one that we're going to be using for taking all of our buccal shots. So I'm just going to grab my retractors. And notice that Haley is my patient. I don't have another assistant helping me take the photos. I don't really need that. I'm going to have Haley lick your lips really, really good. And we're going to be using these retractors. And notice one end is shaped like a C, and the other end, you'll notice, is shaped more like a V. Okay? I like these retractors. It's really going to help us get really good photos. So lick your lips really good, Haley, and I'm going to have you hold those, okay? And we're going to slip these in. So open really wide. I'm going to have you slip that there, and I'm going to have you hold those for me. And I don't want you to pull them straight back. I want you to pull them forward. When we pull it forward, you'll notice that it's going to really open up the buccal corridor, okay? The next thing I'm going to do is, Haley, I want you to bite all the way together on your back teeth. Just like that. And I want you to lift your head just a hair, okay? And I want to make sure that the retractors are nice and parallel and straight out, okay? So I'm going to leave my camera right where it was. It's on a standard 1 to 3. And I'm just going to pull it up here, and I'm going to line everything up. And again, I love the grids because it helps me if I'm a little bit off. I can really line everything up here. So I'm going to just hold that, and you hear the little beep letting you know that it's in focus, and I'm going to take the photo. So the next photo that we're going to be taking is one that a lot of people say is really tough, and I think that it's hard because we're using the wrong retractors. I like to use, and I'm going to sit my camera down here, those same retractors, and I'll take those from you, Haley, where as we saw they were a C on one end, but again a V on the other. This is going to allow us to get all the way back to at least the first molar. And I think that's really, really important. A lot of practices will still continue to use the same end, and it's never going to allow you to do that because you can see how it's shaped. okay? This is gonna make the difference. So what I'm gonna do is have you lick your lips really good for me again, okay? We're gonna slip both of them in, but I'm gonna have the one side be a little bit more relaxed because we're gonna be taking this side first, and then we're gonna go to the other side. So I'm gonna just kind of slip these in for me, okay? And I'm gonna have you just pull that one back and just kind of hold it back. You don't have to pull it too hard. And what I'm gonna do is come here in front of the camera, and notice I'm gonna have her take this hand and pull it all the way back to your ear, not your face, just your hand. Pull it all the way back. Perfect. And do you see how we're able to get back almost all the way to the first molar? Remember that in this photo, it's going to be more like a profile shot, okay? We're trying to get back as far as we can. And again, I'm gonna have you just kind of pull this down a little bit to about right there. And I'm just gonna come in with my camera, okay? And again, the beauty of the camera is that I'm able to really get nice and far back. I'm using my grid again to help me, and Haley, pull it back just a little bit more. Beautiful. My focus is going to be on the canine, and I've got my photo. I've kept it on the same settings, but notice I got all the way back to the first molar so I can see the relationship of all the teeth together. Okay, so now let's go to the other side, and I'm going to have you turn your head all the way this time, okay? And we're gonna just pull this back as far as we can. Beautiful. And I'm gonna come in this way, and I'm just gonna help you a little bit. Got it? And I want you to hold that and bite all the way together. At this point, the patient's starting to get tired, so I wanna remind you to make sure that they're biting down all the way. You don't see any spaces, and just have them do that again. Now I'm just gonna activate my camera again. We're gonna go right back. Okay. And again, my focus we talked about was on the canine. I'm not worried that her hands are in the frame because again, what we're looking for is to be able to see the teeth. I can always go back if I need to crop that. One of the things that I am noticing is the lip here. So just kind of pull down just a little bit. Perfect. Beautiful. Be a little bit picky with your patient. And again, what I'm noticing, I'm going to push play, I've got my gloves on, is I'm able to see the molar all the way nice and straight across. I'm really, really happy with that. Ideally, it's almost like a profile shot. I can see the other central just a little bit, but I'm looking again at the relationship as far back as I can get it, which is the first molar. You can imagine if we have her flip this around, I'm going to have you do this for me. Take this one out and put this in. You can imagine, and just bite down for me, it's going to be tough for me to get that in. You can see how wide it is. This allows us to get further back when we're doing that. If she was to hold that, I literally would only be able to get to pretty much the first premolar. So we'll take those out and give your lips a little bit of a rest. Now we're going to go into our mirror shots, and you can notice that Haley is sitting in the chair, and the first thing I want to do is I want to lay her back. So I'm just going to lay her back all the way to where the top of the chair is basically to my waist, and I'm going to lay it back just a hair more only because she's little, and I want to make sure that I'm going to get up and over and inside her mouth. The next thing I'm going to do is I'm going to grab the retractors, and Haley, I'm going to actually have you hold these for me. So there's one. Remember, we're going to use the smaller end, okay? And we're going to take maxillary shots. So what I'm going to do is just kind of hook this one in and have you hold it. And I'm going to hook this one in and have you hold it here for me, okay? Notice they're not straight across. They're actually in at an angle. And I'm going to have you lift your chin as high as you can. The higher the patient lifts their chin, the further back the tongue goes, okay? So I'm going to grab my camera. And I've also, remember, I've already changed this to a mirror setting. Okay, and I've got my mirror, and I like to use mirrors. We talked about that with a handle on it. And I'm going to put this in, and Haley, lift your chin as high as you can, okay? And I'm just going to go ahead and I'm going to take my photos really, really wide and a little bit higher, Haley. Really great. Now what we're going to do is I'm going to have Haley bring those down, okay? And I'm going to come around in front. And I've got my mirror, and I'm going to just come right in front of her, and Haley, I'm going to have you open really wide. Again, lifting the chin really high is really important. We're going to slip that in, okay? And I'm just going to go right into my photo. And then now it's going to ask me, do I want to switch that again or do I want to flip it again? I do not, because this is a mandibular photo. So again, I like that option though, because there are some times where we have to come in front of the patient and I would need to flip that. It's a great thing for it to automatically come up and ask me, do I want to change it? And I don't, so I'm going to leave it. So now that we're finished with our mirror shots, we're going to just kind of talk a little bit more about the camera and some of the features that it offers. Again, this camera is so easy. Even if you didn't read all the instructions, anyone can pick this camera and use it right away. When I hit my little button here and I'm going to go to my mode screen, I'm going to share you just some of the modes and some of the other reasons as to why you might want to use this camera. They have one for surgery, so if you're doing a lot of surgery, it gets really close up. We have one for whitening, which helps us a lot of times when we're using the other conventional cameras and we take a photo based on the lighting. Sometimes if it's an A1, it looks like a B1 unless we have a shade tab. The great thing about this camera is that it is going to ideally take the exact camera photos, and it really changes the settings, so this way we know that if it's an A2, it's exactly an A2 pre-op, and then when we're finished, if it's a B1, it looks exactly like a B1, so we don't have to worry about altering those images. We have our standard mode, which is 99% of the time what I'm going to use, and that is easy for anyone who doesn't want to worry about changing those settings. You could use standard for everything. We talked about the face mode in order to take our full face photos. We've got our mirror shots. We also have our telemacro, so if it's one tooth that I'm really trying to match ideally for the lab, I would turn it on a telemacro for that. This is probably one of the easiest cameras I've ever used and highly recommend it whenever we're taking this 8 series for Invisalign.